Captagon in East Africa and the Middle East. My name is Yasmin Sabih. I'm a board member of Najm, and I have the honor to moderating today's discussion. Before we begin, I would like to inform all participants that the side event will be recorded. This is to ensure that we can document all valuable insights and recommendations that will be shared today and make the discussion accessible to a wider audience after the event. The issue of drug trafficking and substance abuse is a global challenge. And today, we turn our focus to the specific regional dynamics surrounding Khat and Captagon in East Africa and the Middle East. These substances pose significant threats to health security and socioeconomic development in the affected countries, demanding urgent attention and collaborative solutions. Our aim today is to deepen our understanding of the issue and explore potential avenues for effective intervention. Now, let me introduce our speakers who will be sharing their expertise with us. Welcome our speakers, welcome our experts. We are so grateful that you join us today. First, we have Amira Nasruddin from the Lebanon Ministry of Social Affairs and Director of the National Program for Guidance, Training and Prevention. Amira will be providing us with insights Lebanon's national response strategies. Amira, the floor is yours.
Good afternoon. Please let me start with good afternoon. Please let me start with a word from Adek. The bold don't you tell make you stranger. A grave challenge. Lebanon faces a growing threat from the abuse of Khat and Captagon, substance that endanger public health and socio-economic stability. The minister mandate. As the primary government body responsible for social welfare, the Ministry of Social Affairs is at the forefront of Lebanon's response to this crisis. Our mission is to prevent substance abuse, provide effective treatment and rehabilitation, and reintegrate individuals into society. Understand the threat. Khat stimulates causing euphoria and alertness, but also leading to adverse health effective to like cardiovascular issues and mental disorders. Captagon. The Captagon is an amphetamine type stimulant, highly addictive and linked to serious health complications and aggressive behavior. Lebanon's is vulnerability, the country's socioeconomic challenges and geography location, but make it susceptible the drug trafficking and abuse. Let me give it some statistics. For 2024, drug prevention in school among ages 13 to 15, drug use by age under 18 years 10.5, 18-25, 35.5, 25 to 36, 85. Over 36 old, 85. Most commonly used use substance, cocaine, heroin, Captagon, specific substance, our percentage, 19 cannabis, 32 heroin, and 15 cocaine. The ministry multifaceted approach. Prevention is the key. Yes, the prevention is the key. National program for guidance, training, and prevention. This program is the cornerstone of our prevention effort, focusing on education, awareness, and early intervention. Target intervention. We design specific programs for youth, women, and marginalized community, considering their unique vulnerability. Community engagement. We actively involve schools, family, and local community in a prevention initiative, fostering a collaborative approach. Treatment and rehabilitation. Accessibility services. The ministry ensures access to nationwide to network of treatment rehabilitation centers, providing a range of evidence-based interventions. Holistic care. We adopt a comprehensive approach to treatment, addressing the physical, psychological, and social needs of individuals. Reintegration support. We assist individuals in their reintegration journey, facilitating their return to productive lives and reducing their risk of relapse. Collaboration of partnership. National synergy. The ministry works closely with other government agencies, law enforcement, and healthcare providers to create a coordinated response. International cooperation. We actively engage with international organizations like UNODC and collaborate with regional partners to address cross-border drug trafficking. The way forward, data-driven strategy, we prioritize data collection and research to inform our policy intervention, ensuring they are effective and evidence-based. Stigma prediction. We combat the stigma associated with the drug addiction through public awareness campaigns and promote a compassionate approach to treatment. Sustainable solution. The ministry recognizes the link between drug abuse and socioeconomic factors. We advocate for publics that address poverty and unemployment and track offer opportunity, creating a more resilient society. Conclusion, a collectivity responsibility. The fight against Khat and Captagon requires a collective effort. The Ministry of Social Affairs is detached to leading this charge, but success depends on the active participation of stockholders. A hopeful future. By working together with determination and compassion, we can create a healthier and more secure future for Lebanon, free from the crime and drug abuse, and finally support youth to make prevention behavior. Thank you for all. Thank you.
So sorry, we cannot hear you.
I don't have a microphone. Yeah, it's a problem.
Okay, you cannot hear us?
Now we can hear you. So sorry. Now we can hear you.
Oh, sounds
The
good.
mic was open.
So, with that being said, I don't know if you have my PowerPoints.
No. Yes, we can.
But I'll take the time just as you mentioned, Yasmin, I'm working from the health response to drugs, mainly focusing on prevention. But I thought when I was preparing the presentation, there are so many things we can cover when it comes to Captagon and Khat in terms of the Near and Middle East, from the epidemiological situation of the supply reduction measures and beyond, and the tools that are available and the priority of what needs to be set. So to be honest, I put a bit of everything, but I'm going to be very brief on everything that is going to be mentioned. And the PowerPoint presentation that should be coming out any minute now, we'll start with the epidemiological situation. I will talk very briefly on it. It's a very complicated scene, but there's information within it on where to get and where to read more about the situation. So, but generally speaking, it's not. I know we're focusing Near and Middle East, but the situation is not only in the Near and Middle East that have a problem of drugs. It's global. There is a growing percentage. 20% increase over the 10 years in the sense of the percentage of the population that's using. Number-wise, it's 292 million. The large increase is also because of the fact that there's a bigger chunk of the population that's a young population on planet Earth. And the more you have a young population, the more that the number in absolute terms would grow. Because this is the age of initiation of substance use. The ranking of the substances you can see in the slides in the sense of, yes, plant-based substances remain in the lead, but there is a very growing number of new psychoactive substances, synthetic drugs that are being produced, and now it's becoming the trend because it's much easier to hide the production of these substances and kind of smuggle these substances and their precursors than it's the plant-based substances, but it's not to ignore the importance of plant-based substances. The spectrum of the leading problems across the world, yes, it's a global problem, but different regions face different challenges with these substances that exist. And in this context, I zoomed in for the next slide. I zoomed in specifically the region that you wanted to focus on. If you move to the next slide. In this region, you see in North Africa, the non-medical use of tramadol, there's an increase of cocaine trafficking from Latin America all the way to Europe through this West Africa up to North Africa region and also but there is always a spillover effect in the local market when the drugs are available. The Orient Gulf, let's say, region, methamphetamine and Captagon trafficking and use is like, the burden when it comes to substances. And if we go a bit north from the region, opiate production, trafficking, because the opiate route starts going through the Balkan region, and the methamphetamine manufacture, as well as, also whenever you have amphetamine, where we have like especially heroin and opiate use, there's a modality of use that's also linked to communicable diseases, where it becomes a burden because of the modality of use of these substances. So basically, yes, the region that we're talking about has a big problem with that situation. If you go to the next slide, the trafficking routes also of these substances. By the way, I have more information on the Captagon because Khat is a substance that is not under international control, and thus it's not necessarily on the radar of the drug control system and mechanism. I can tell you from the Captagon situation, in terms of seizure of amphetamine, especially Captagon, the statistics of 2020 to 2021, in Iraq alone, there was a 3,500% increase in terms of substances seized. And, as an indicator, this is what's seized is, is a part of what exists. It's a combination of one, by the way, better efforts in terms of control and seizure. It might not necessarily be that the volume has increased, but there's better efforts. But definitely is an indicator there's a problem, right? In 2023, 4.1 ton of Captagon tablets were seized. You can imagine how big that volume is, and this is only Iraq. And needless to say, I don't need to describe the situation in the region, but a high level of instability, a legacy of armed group that exists. All of these are vulnerabilities that increase the traffic, but also the vulnerability. So this is if you want to get more information on the epidemiological situation, there's a specific report that was done by our research and analysis branch and our office in Romania on drug trafficking dynamics, trends and responses, that focuses a lot on the Captagon situation. You will read a lot more on the statistics online. You can Google it. This is just a slide to showcase, the diversity of country. I can point to Iraq, but that's not the only country where seizures exist, and the seizures are increasing when it comes to amphetamine and Captagon. But throughout the Middle East, you can see in many of the countries of the region, the seizures are on the trend of increase. Next. That's the epidemiological situation, but also generally speaking, we know that there's, in terms of use, there's a big diversity, the difference between men and women in terms of substance use when it comes to diversity, and the problematic might be different by men and women in terms of a profile. This is the profile of use, but when it comes to specifically under the controlled substances, non-medical use of substances that, medical substances that are under international control, the situation between men and women is 50-50. So it's a problem that for both gender, generally speaking. Now looking at specifically in the Middle East, I might have the exact data, but definitely there is, in the adolescents group, there is a growing percentage of threat. Can you move to the next slide, please? And then this is in terms of the 294 million that I talked about was actual anytime use. But we know that at least 64 million of these 294 have problem drug use that requires treatment. Can we go to the next slide, please? And before I maybe I missed that slide, but accessibility to treatment is different than, so basically it's 50-50% when it comes to non-medical use of substances, but access to treatment, there's a big discrepancy between women access to treatment and men access to treatment, with women being much more challenged or stigma and other reasons to access drug treatment. Now, when it comes to services, prevention-wise, we can tell you that prevention is substance neutral. Of course, awareness on substances is important, but it's not the key element. Prevention goes beyond just raising awareness, and there's a lot of things that can be done at different ages of development. We have the standards, and we have sector-specific responses that need to be taken into account in the school, in the family, and in law enforcement officers, and their role in prevention as well is key. Next. We have a lot of tools that are for the family skills perspective that are currently available. And we're not talking about the parents being law enforcement officers and talking about their kids about drugs, but really building a caregiving relationship between the parents and their children, that's the key element. How to properly monitor, to have a good communication and engagement in different age of development and beyond. But because it's a region where there's not only unique, but in the Near and Middle East, because of the crisis situation that exists, beyond the family skills, the caregiving skills that we have, generally, we have also leaflets and booklets in multiple languages that can help caregivers in crisis situation, war, conflict, displacement, how to deal with a sudden change in the context in which you are parenting, that are available in Arabic language as well and accessible. Next. Life and social skills are important skills too. So beyond caregiver and their children, their relationship, the person themselves having their own resilience to resist social pressures and to react to social pressures. There's several tools that exist and are available in the region. Some of them are sports-based, some of them are school-based, some of them are community-based, and some of them are peer-to-peer, friend-to-friend. Next. And also we have, grants mechanism where implication of youth in the response is a key component. And youth is a core component, not only as a recipient, but a part of the response. All of these are spectrum of things. I'm just going into just the general headlines of what the programs are. Next. And systems of prevention are being established, including in the Near and Middle East. There we have Algeria and Egypt, as first countries, but we hope we have more countries from the region implicated in this. For treatment of response, we have a large menu of services. I will not go into its details for time reasons, but I want to show you what exists. Next. Treatment, there is investment of treatment. We have programs that kind of support evidence-based approach when it comes to treatment, and we have UNODC, WHO, international standards to guide what kind of response. This is the tool that exists. These are to assist and support countries in terms of orienting the response and improving the quality. We have a specific initiative on overdose prevention, particularly in terms of opiates use. Next. Of course, we have sector-specific responses in terms of how to provide the healthcare response within the criminal justice system. Also, within the healthcare sector, particularly when you have pregnant women, and in terms of substance use responses. And now a new initiative that you probably heard of is Scale Up in terms of addressing more research in the context of stimulant-based research, because the area of pharmacological response when it comes to opiate use is much more advanced. But the research in the sense of orienting the healthcare response from amphetamine time stimulant is poorer in terms of dearth of possibilities. And this is a new initiative that's being launched this year. I guess, and access. Just a small bracket. We are talking about substances are under international control. Supply reduction measures does not mean that people that need this medication for healthcare reasons should be deprived from the substance just because there's a misuse of the substance and diversion of the market. So ensuring access and a balanced approach for those who need it for medical reasons will get access to it in the context of a problem, and how to contain it only for medical purposes is part of the programs that we have and the accessible program. So I will stop here in terms of a description of what it is and the epidemiology, but I'm sure like we hear from the rest of the panel with more enriching conversation.
Thank you, Dr. Mahdi. Very important. Thank you so much.
We need the slides.
Yeah, we will share it for you. Our third speaker is Dr. Musa Dawood, President of the Jordan Anti-Drug Society. Dr. Dawood, please proceed.
Many thanks, Yasmin, and a big thank also for Najm for giving me this opportunity. And I extend my thanks to the International Federation of Turkish Green Crescents for the support in all aspects, which allow us to join you together on behalf of the Jordan Anti-Drug Society, I would like to show my great gratitude to you. It's an honor for me to be joining you as a panelist with great panelists and experts here. You know, our work will make us learn more and more from such distinguished speakers and panelists. I had a plan to travel today, so I re-record a video, and the plan was to make it here. So now we mixed both of them. So I would like to thank you, and I invite you to listen to my recorded video. So please play the video.
Sorry, the sound is not coming, right? We are not hearing.
Nasıl sözün gideceğini ayarlamaya çalışacağım bir saniye.
The voice is not going. So
Can you call Nadia, please? You can call the lady. She's outside, so she can have a technical issue. But until yes, of course. I would like. I prefer to proceed live since I am here. So
let's stop and we will continue. Okay.
all right. So back to the Captagon issue. However,
I think now it's okay.
Yeah.
however, he's listening to our voice, but not to the video.
But now it's okay.
All right, then continue.
Okay.
A challenge for distinguished
So now we
guests,
can
esteemed colleagues. It's an honor to be here today to address a critical and growing challenge that threatens not just public health, but also regional security and economic stability. The interwined crisis of Khat and Captagon in East Africa and the Middle East demand urgent and collective intervention. For decades, Khat has been deeply embedded in the cultural and social fabric of East Africa and Arabian societies, used in a traditional gathering and social setting. However, its increased consumption, particularly among youth, is now raising major public health concern, including addiction, mental health, and economic hardship. Moreover, the expansion of its illegal trade into Europe is posing a new legal and regulatory challenge for affected countries. In some regions, khat farming is also diverting valuable agricultural resources, worsening food security and water scarcity issues. Captagon, however, presents an even more urgent and destabilization crisis. Originally developed as a medical stimulant, it has been weaponized by criminal and extremist networks, especially following the Syria civil war. Today, Jordan and neighboring Middle Eastern countries are at the forefront of the fight against Captagon trafficking, as millions of pills are being smuggled across borders. Jordan's security forces have conducted multiple high-profile interceptions of Captagon shipments. Yet, the trafficking networks continue to evolve, adapting their methods and routes to evade detection. The production and trade of Captagon have transformed into major geopolitical issue, financing armed groups and fueling organized crime. the sheer volume of Captagon being smuggled from Syria into the Gulf states via Jordan poses to severe risk in border security, public health, and national stability. If unchecked, this illicit industry could expand further into North Africa, Europe, and beyond, already fragile security dynamics of the region. Despite the differences between Khat and Captagon, several common factors are driving their proliferation. Number one, economic vulnerability, where struggling communities turn to cultivation, production, and trafficking for survival. Number two, weak regulatory environments, which allow organized crime networks to operate with impunity. Number three, cross-border trafficking routes, which sustain the illegal drug trade and reinforce criminal enterprises. The way forward. First, regional cooperation is essential. Countries in Middle East and East Africa must strengthen intelligence sharing mechanism, enhance cross-border enforcement, and create joint task forces to disturb trafficking network. Jordan has been proactive in implementing security measures, but without border regional collaboration, these efforts alone will not be enough. Second, the role of international organization must be expanded. The United Nations Office on Drugs and Crime, UNODC, the Arab League, and regional anti-narcotics agencies need to support capacity building efforts, providing advanced surveillance technology, and foster policy alignment to create a unified front against drug trafficking. Third, prevention and intervention must be a priority. We cannot fight drug trafficking purely through enforcement. We must address the root cause, poverty, unemployment, and lack of education by offering sustainable socioeconomic alternatives. For Khat farmers, alternative crops and economic incentive can reduce dependency on this trade. For those vulnerable to Captagon trafficking, education, skill development, and job opportunities can provide a pathway out of illicit economies. In Jordan, the Jordan Anti-Drug Society (TJADS) has been actively work on prevention programs, awareness campaigns, and rehabilitation support to protect at-risk communities. A call of action. Jordan, as a frontline state in the battle against Captagon trafficking, has invested heavily in the border security and enforcement operations, but we cannot do this alone. The fight against Khat and Captagon must be a shared responsibility among governments, civil societies, and international organizations. We must act now. We must act now by enhancing regional cooperation, strengthening enforcement and prevention mechanisms, and investing in psychoeconomic solutions to prevent these substances from further destabilizing our region and threatening our future generations. Let us turn this urgent crisis into an opportunity for collective actions and lasting change. Thank you.
Thank you. Thank you, Dr. Dawood, for highlighting the critical role of community-based initiatives and the importance of addressing the root causes of addiction. Following that, we have George Odano, Executive Director of Stone Child Foundation. George, the floor is yours.
Thank you so much, Madam Moderator, for the opportunity to invite me to speak at this time. Most of, or some of the things that I'm going to touch on have been touched on, so I'll try my level best to be very fast. One, I put a lot of emphasis on East Africa and Khat. And to be honest with you, I think we have a very severe and big problem within East Africa when it comes to issues of cat. And many might ask, why are we focusing on cat? If you look at Captagon, it is not a very common drug within the East African community. And in our pursuit to ensure that we try our level best to address this, we've been trying our level best to understand the regional dynamics that comes with issues of cat by trying to ensure that we're able to assess the social, economic, and security impacts and explore interventions that are working out, especially when it comes to children, because cat has really affected the young people within the region. Children are dropping out of school because they see quick labor and so on and so forth. Maybe just to understand what cat is, according to that definition, it is a stimulant plant that is widely consumed within East Africa. I'm not so sure about the other side, the Arabian Peninsula, but in East Africa, I'm talking of what I've seen working. And the affected countries remain to be Kenya, Ethiopia, Somalia, and Yemen. Kenya, Ethiopia, Somalia, like in Kenya, we export cat to Somalia. And we have people who are doing that business. And whenever you are on the road and you meet the people who are transporting this to the airport, it is either their way or no way. So it has also health effects, the euphoria, hyperactivity, addiction, cardiovascular issues, and so on and so forth. And again, it is a major cash crop for a certain community in Kenya, and they depend on this. That is why you realize that most of the children drop out of school because they want to be involved in the production. This is quick cash. You are invited to go and work in the farm. So I'm trying to imagine a child who is age 12 working in a farm. I think there is a lot of violation of children's rights in this, because a child is working and he's not supposed to work, he's supposed to be. And a lot of politicians have also been able to join into this because they use it as a political tool to sell the agenda to the voters and the wider community. The Kenyan agencies have also, I mean, the government agency have not been able to give a clear statement on this because there are things that we call the touchable and the untouchable. If you look at the countries that have legalized that, Kenya, it used to be legal until it was legalized because of the political influence by the politicians who use that. If you look at other regions within the East African region, they've not allowed this because they've seen the impact. And there is slowly an increasing consumption within the region, and a lot of people are now diverting into that direction, because if it's allowed in Kenya, why should I not go to Kenya, use it, and then we used to have a problem during COVID whereby people would cross from Kenya, Uganda, come to Kenya, take alcohol, and go back to, because the time frame is different. There is a curfew that starts at this time in our country. So, and there is a curfew that starts, there is the different time zones. So I would rather go drink in Kenya and then come back to my country. It is the same thing with cat. There are people who prefer, because it is legal in Kenya, let me go use it, especially the people who are around the border. Let me go use it in Kenya and then cross the borders. It is being smuggled in countries like Djibouti, Somalia, and so on and so forth. It has, I think, for me as a person who promotes prevention next, I would really urge that there is an urgent need for health and awareness campaign on this. I know there is political aspect into it, but what is here and our plea to the UN is that if we can come up with a clear framework on how to do this or address this, it will help the upcoming generation, because this is not something that is affecting the present generation much. It is affecting the upcoming generation. We need to do something about policy reform, and we need to engage the policymakers. Musa talked about economic alternatives, and there is need also to enhance the regional and international collaboration when it comes to addressing issues of cash. Next. And then a call to actions. I would really want to see government prioritizing the strategies of anti-drug strategies within the community and especially at the grassroots level, because this is where everything is being done. UNODC develop good manuals, they are implemented at the grassroots level, not at the boardroom or in these big international forums. They are implemented at the lowest level. So if government can embrace that, it can be good. And then the issue of funding, I know it's a big problem, but we need to divert our attention and ensure that we address this emerging menace that is trying to kill our young people. I would also encourage other youth-led organizations to join us in doing this. We need the religious people into this and other things. Then we need to strengthen the cross-border cooperation on enforcement of this. In conclusion, I would want to say next. In conclusion, I would want to say Khat and Captagon are not just health issues. They are security, economical, and social threats. And I would add even the human rights threats, especially to looking at it from the children point of view, that needs to be addressed, not yesterday, not tomorrow, but now. And now means now. And then we need to enhance the coordinated regional approaches that is able to bring a sustainable solution to this upcoming generation. And then I tend to believe that together we can be in a position to prevent this future crisis. Thank you so much.
Thank you. Thank you, George, for bringing the urgent need for targeted interventions for youth. Now with Dr. Abdulkader Siraj, board member of Green Crescent Ethiopia. Dr. Siraj, we welcome your contribution.
Thank you very much. First of all, I would like to thank all the panelists and International Green Crescent Federation for this event, make this event to happen. And the issue of chat is it is really explained by our colleague from Kenya. And that's really the problem, basically in the East Africa. For Ethiopia, it is a very huge problem because Ethiopia is the largest producing country of Khat, and it is the second revenue for as a cash crop, and that's why next to coffee. And so I would like to go through that things again. Here, okay, good. Thank you. This is the close picture of the leaf, and as they said before, also it's a psychoactive substance which contain catine and catine, and this is the main two substance which are very similar to the amphetamine, and the chart is said it is the natural amphetamine. They said it is a natural, it's like amphetamine like substance. The community-based studies, sorry,
Dr. Siraj, we cannot see your slides, so if you can share your screen, please.
Actually, I have shared it. Let me.
I'll see it. Can we share it from inside?
Okay.
Okay. We will share it. We will share it. We will share it. Continue, please.
Okay. Can you see now? Is that okay?
Yeah, it's cold.
Yes, we can. Yes, we can see it, Dr. Siraj.
Okay, sorry for that. Okay. Yeah. Historically, it is known that it's in the our region in Ethiopia. It is seen there. It has been seen there in the 15th century, and then goes through the Yemen in the 16th century, and the prevalence there in Ethiopia it is about 15 to 23%. It is in the high school and university students. It is up to 23%. They said the studies shows that, and the factors that affect the consumption of that is the first thing is the gender. The being male is very that have a higher access to that, and the age groups 1920 to 23, the peer pressure, family history of chewing chat, the urban residence. And also for the, for example, for if the area is a producing area, for example, in the southern east and the southern area of Ethiopia is the largest producing area of that. That's why in that area they consume about 50% of that population where consumes that. And also the other thing, as they take as psychiatric drugs, they use, I think, by in the tradition, they use it like that as a self-esteem to energize itself or himself for someone, and other purpose also. And the other health effect and the other impact of that is it has a cardiovascular effect, and the gastrointestinal adverse effect also, and also the mental health problem. It may all come to that case, but here we cannot say some research showed that the mental problem is not it has to be researched a lot. The results in hand are not really consistent, they say. Yeah, let me go this one. So globally, each day, about 10 million people really consume chat daily. Currently, Ethiopia is a leading in production of chat, and because it is, as I said before, it's very important for economy, and that's why the government buys it intentionally. I can say this. Do not want to influence and have a regulation on that, because it's really affect the economy of that our country. That's why, for example, here, here the cultivation of chat is growing rapidly. About 275 million kilograms of chat was cultivated. That is around 2014 and 2015. It's a really huge number. In 2023, the annual earn in dollar, it is about $450 million. That in that year, but after the next year, I mean after 2024, that really comes down, because the regional governments in the highly producing region, they really implement high taxation for that specific region. There are also licensed traders in that region specifically, and the regional governments wanted to have to earn much more than expected and the last years. So that's why they implemented extra tax and to get higher. And after that, this number goes down to 100 and to up to from 100 to 100 to $200 million the last year. Yeah. And let me go. For the implications, I mean, for the policy or for the regulations in Ethiopia, there is no sorry. Okay, in Ethiopia, there is no the written regulation, and that is being implemented by the government, and that's why there may be some rules there and some as a campaigns for specifically for the regions which are really producing much. But that is not really for the health impact, for the social impact of the drug by itself, but only for the tax of that specific region for the to increase the surface of the that specific area. But for as we know, it is very affecting drug in the area. So I think this I jotted these things to be really we need to do this in the coming years for our government or for our societies also. So the government should really introduce and disseminate high income elastic cash crops for farmers because it is really the income for that specific farmers, and we have to substitute this to the other crops and subsidize them to compensate for the benefit obtained from the crop. And the second is the government need to involve at all levels to develop effective regulatory legislation for the socio-economic management of that, to reduce abuse and the negative impacts of the substance on the government's wide plan. And these other things, the government should put high tariffs and taxation. That is really being done now. And the other things that really has to be done there is the marketplace should be bind legally for art distribution as a demand for plants reduce among youth and working age population, and all inclusive and community-based awareness regarding the adverse impacts of the plant should be given through mass media, public forum, and other information division mechanism. And as my colleague says previously, lastly, I want to it's really not only the health issue and to be considered in that area. It's really an economic issue, very important. I think we have to underline that thing. If we really are to solve the problem of that in that specific region in East Africa and the Middle East, we have to do in collaboration with other regional countries and solving the economic and social issues also at the same time. And thank you. This is what I have to say, and thank you.
Thank you so much. Our last speaker, unfortunately, he won't be able to join us, Dr. Tariq, board member of Green Crescent Syria, because he's facing some issues with internet. So unfortunately, he will not be able to join us. Our online participants, I forgot to welcome you. I just want to tell you that you can submit your questions via the Q&A box. Okay. Our speakers, thank you so much for joining us. Anyone from our participants want to ask?
Yeah. Well, thanks, Yasmin, for this opportunity. Thanks for the panelists. Thanks for Dr. Musa Dawood. Thanks for Dr. Ma'louf. Thanks for Dr. Odalo. This was a very great presentation from all of you. But the thing is that I'm a psychiatrist working in Jordan, And I work with MSF Jordan as well, not only with Dr. Musa and the Jordanian Anti-Drug Association. The thing is that I treat a lot of Yemeni patients and a lot of Somali patients. So, and on the other hand, I treat Jordanians and people from the Gulf cities. People from the Gulf cities, they take Captagon a lot at times, and people from Yemen and Somalia, they take Khat a lot. These like chemicals in the brain, they are translated into adrenaline and noradrenaline and dopamine. But there is no one like on earth would like only just like to have adrenaline, dopamine until the end. No, he tries as much as possible to just like take Captagon and take alcohol, take Captagon and take pregabalin, just like take Khat and take alcohol, take Khat and take Xanax. So would you please give us kind of like more, let's say, precise like vision on Eastern Africa and the Middle East with regards to the downers, not only the uppers, which are the Khat and Captagon, from your own perspective and your expertise?
From my side, I mean, I can tell you that this is beyond my field of expertise.
Okay.
But in terms of the treatment response, because you're asking me the question and you're the expert.
Yeah. I want to see other.
But yes, but I can tell you from an epidemiological perspective, because I'm an epidemiologist, I'm not a therapist. Right?
Yeah.
The context of polydrug use is very common. And the context of mixing uppers and downers, I mean, there's two things. There's a person-centered approach to the response that is key. There's a certain vulnerability, and that vulnerability is at different level within the individual, the structures that leading to substance use. But post-substance use, it becomes that vulnerability is still in existence, that need. Yeah? And there's a substance that's hijacking your personal decision-making processes inside.
Yeah.
Now, not knowing a lot in terms of how mixtures are done, I can tell you that from an epidemiological perspective, this mixture between uppers and downers is not too surprising from previous history, right? The Australian sort of context in terms of what happened in the epidemiology of drug use was a good example, good and bad example.
Yeah.
Because shortly after the Afghanistan war that happened, I think 2001, 2002, the Australian market, in terms of heroin use, the entire Australian market was the heroin that was there was coming from Afghanistan.
Yeah.
Right? And suddenly there was a sudden shortage of that substance, where that substance was not in existence. So a profile of drug user that using a downer, you would imagine that it needs to be replaced by another downer from the community that's using that sort of substance.
Yeah.
Oddly enough, statistics show that while the use of heroin because of the shortage was getting low in terms of opiates in general, the use of amphetamine was mirroring that shortage from the same community.
Yeah.
So sometimes it is the substance, the availability of the substance that determines the drive. It's not necessarily the need of the person, but maybe what's in the market. Right? Because the vulnerability exists. So all of these are into play, and probably that is also one of the aspects why you will see that clinical diversity in the market.
Yeah.
But I can say again, I'm not a therapist and tell you what's going in the brain, but epidemiology is not very surprising.
Yeah.
And including the polydrug.
Yeah. But the thing, if I may just is that, for example, like pregabalin or like Xanax, like 10 or 20 tablets. Okay, we always hear in the UN say that illicit drugs like cathinone, Khat, and amphetamines and crystal meth and Captagon, they are bad ones. But like 10 tablets and 20 tablets of pregabalin are bad as well.
Dr. Ahmed, I'm so sorry. We need to proceed because we don't have time. We have 3 questions. First one, my question is for Musa Dawood. Considering the new dynamics in Syria, I mean the new government, how do you see the Captagon flow in the Middle East, dear Dawood? Can you expect a decline for a more hopeful future?
Yes, of course. Nowadays Syria is in a transit period with the new government and new management for Syria. We hope that the situation will be much better than before. Actually, I have a view of, for a while, manufacturing Captagon will be stopped for a while. But we don't want to forget that manufacturing synthetic drugs, it doesn't depend on governments, because usually those groups are not belong to governments, to any governments. But because the previous government was facilitating such groups, so they were be able to produce much more synthetic drugs. But now they still have some raw materials in the stores. So it will be a decline of producing synthetic drugs like Captagon and crystal meth. And if the new government doesn't control all the area, all the region of Syria, then we might have a reproducing the same amount of synthetic drugs, Captagon and crystal meth again. But it will not be like before, like with the previous regime of Syria. So I am optimistic. We might have a very positive improvement. And also there is another improvement in Jordan government, because as I mentioned earlier during my speech, that Jordan invests a lot in borders, civilians, and technology. Now they implement very high tech to detect such trafficking.
Thank you. Thank you,
Thank you
Mr.
so much.
Musa. Dr. Marouf, you have two questions, but unfortunately we don't have much time. You decide if you can answer on both of them, or you choose one.
Choose one.
Yeah. No, I can choose.
You can
Very
say
briefly,
mine,
I can do it very briefly, both of them. The gap, I will start with the gap. The prevention and treatment gap in terms of strategies are mostly focused on this, not in the lack of interest or the lack of investment, but investing in things that are not necessarily that are the most effective. And working by silos rather than working as a multi-sectoral approach. It's a person-centered approach. One sector cannot be responsible for all the spectrum of the responses. With regard to family skills, family is one of the important social institutions, because it's one of those institutions where it can, when you change its momentum, it carries an effect for a very significant longer period of time. It carries with the growth of the individual. So these are the most sustainable solutions when it comes to, as long as they are evidence-based.
Thank you.
And age-specific.
Thank you, Dr. Marouf. Thank you again to all our speakers for your insightful presentations. Unfortunately, we have reached the end of our allocated time. I would like to extend my sincere gratitude for our speakers for their invaluable contributions, and to all of you, both in person and online, for your active participation in the important discussion. Thank you all. Let's take it.
Thank you.
Okay, thank you.
Where you would like to have the group photo?
Yeah, maybe or
outside.
Outside.
Online.
Okay. Can you keep the panel online? Yes, we will take photos. Okay.
All right.
Yes, perfect. Stop it.
So can you join us just
Yes,
behind
join
us?
us.
Please,
Please join us.
join us. Please join us.
Okay.
Please.
Just
So people here?
In that case,
Yeah, you to the.
Otherwise, I'm not you are the presenter.
No, you are the speakers. Okay. Thank you so much. Thank you all.
Thank you.
Thank you.
I guess that this is the last time for this CND.
Yeah, I think this is the last session.
Is there a session after?
There are other side events afterwards.
I know that
Thank
there
you.
is a
Oh, you didn't join us in photo. Oh, it's not problem. Thank you.
Thank you so much, Dr. Siraj. I will end the session. Thank you.
Okay, thank you. Thank you.
Thank you, Siraj. This should I'm closing the session.
I'm ending the session.